Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. And in this video, we're going to be talking about the interesting patient. Now, all practices have interesting patients, and we all know what we're talking about. So I'll discuss one that came in just the other day. We had seen this person before, several months prior, had come in for a very brief consultation. Didn't want to spend much time or money, and we immediately identified, without any x-rays or anything else, that there were two cavities that were very obvious. But the patient also was thinking about maybe repairing existing partial dentures or maybe replacing them, wasn't quite sure. So fast forward to the other day. So 3 months later, we see this interesting patient, very nice patient. And the patient proceeds to say that yes, she thinks she has cavities and she doesn't know exactly what she wants to do with her partials, but one of her teeth is now hurting her. And she said it hurts to chew, and she tapped on it with her finger and it hurt to that too. So of course, with that, we got an x-ray of that area because we didn't have any previously. And so we wanted to see what was going on to give her a better idea of what was actually occurring. In the process of waiting for the x-ray to be developed, she was talking about the possibility of an abscess and how she was using coconut oil to solve her abscess issue. Natural remedies, of course. It obviously, I'm not sure it really was working so well because it still hurt her to chew and tap on it and everything, and it had for several days to weeks from her history, which was also a little bit unclear. So then she proceeded to tell us that she was going to another dentist to have an impression for teeth added to her lower partial. And she had a cavity on one of her lower teeth, at which time I did proceed to tell her that, it'd be great, instead of us doing work or evaluation, if she already had appointments set up to have her partial repaired elsewhere, that maybe the other office would probably be best to handle everything, because now we're getting a couple of different people involved, and if they need to do fillings, they could shape the teeth the way they wanted for the partial to work. Well, she was confused, and she was saying that she didn't like the idea of doing fillings on certain teeth that the other female dentist had said was soft, and wasn't sure about spending the money. And then we got the x-ray back. Sure enough, there was an abscess, and I let her know that her options included extracting the tooth or doing a root canal to keep the tooth, which is something that I recommended because it's a big tooth and a canine up in the front. And she wasn't sure because of the cost, and she was fidgeting around, and then she said she even went to a male dentist, another one, who suggested taking out all of her teeth, and doing 2 new full dentures, upper and lower. And she wasn't sure about that either. And at this point, I was very, very concerned, because now she's been to 3 dental offices with 4 different dentists getting involved. And so now we have everybody kind of getting in the mix. And I said, look, for her, I would recommend doing a root canal on the one tooth. Then I noticed that 2 other teeth of hers were extremely loose. We took an x-ray of that, and we found that they also had abscesses in addition to moderate to severe bone loss. So I told her we could add teeth to her partial denture, extract the teeth that needed to be extracted because there was poor prognosis, poor chance of saving them, and then let her do whatever else she wanted to along the way. So she then proceeded to talk to us about another lower tooth, separate from everything else, where a dentist had told her either to do a root canal or to pull the tooth because it was an infection, but her coconut oil has been faithfully keeping infection at bay. She uses it very religiously and faithfully, and so yes, that is of course an interesting story, trying to get every dentist in town to get things done and trying to figure out prices, as in fact the very next day she called back to try to find out how much it would cost to add the teeth to the partial denture. So yes, always an interesting patient, and hopefully I've enlightened you, and you will be sharing your interesting patient stories too, because we all have them, and we all, quite frankly, look back and enjoy what was a very, very unique type of service when they come to the office. So, hey, I appreciate you joining me on this story about the interesting patient, and I hope you're all staying well and healthy.